Plantar fasciitis really is a difficult problem to treat, but one of the main things that we do in trying to deal with plantar fasciitis is stretching that ligament out. But I also feel that it's important to massage that area, perform some deep tissue massage to help break up some adhesions that have occurred on the bottom of the foot. And so this video kind of goes over those two techniques that I'd like you to try. You either should do this first thing in the morning, especially if you're somebody who suffers from morning heel pain. If you're someone who suffers from a heel pain that's primarily present in the evenings, then this is something you should do in the evenings. It doesn't have to be long. You do it for maybe 5 to 10 minutes once a day. And if you do this on an ongoing basis, you are going to feel results. Initially, though, it is going to make your foot sore, especially the cross-friction massage. This will make the bottom of your foot sore the first few times you do it. But what you're doing is you're breaking up scar tissue and adhesions to the bottom of the foot that have been there as a result of chronic pain, inflammation, and swelling of the plantar fascia. I wanted to use this model to illustrate the complex nature of the bottom of the foot and to show you exactly what it is that you're doing when you're stretching your plantar fascia and performing the cross-friction massage. So if we look at the bottom of the foot, what we see is that we have right under the skin the plantar fascia, and this is obviously the source of our pain, but really it's only part of the story. So when we're stretching our plantar fascia, we're stretching this structure out, and we're pulling our toes back to affect a stretch along the course of this. But if we look underneath the plantar fascia, we really see that it is quite a complex arrangement of muscles and tendons and arteries and nerves. But for our topic of discussion, the important thing to keep in mind is that we have a significant amount of what's called intrinsic muscles within the bottom of the foot. And these intrinsic muscles become bound down and adhesed with people that have had long-term plantar fasciitis. So not only is it important to treat the plantar fascia, but it is also important to address the intrinsic muscles. And that's where that deep tissue massage or cross-friction massage comes into place, because what we want to do is we want to actually get these muscles to loosen up. They can actually bind down. There's several layers, and the layers can actually become fused together from scarring and from chronic inflammation. And we want the muscles to be independent little muscles just like this with very discernible layers, and sometimes that is something that gets obscured in the presence of chronic plantar fasciitis. So as you can see, there really are a number of different muscles all along the bottom of the foot, which all can be affected. And it's important that we address all of these muscles in order to be able to get a good resolution. So after we take away all the layers, we're left with this structure here. This is the spring ligament. This also can become inflamed, and so that's where deep tissue massage also plays an important role in helping to provide some friction to this area to loosen it from its overlying muscular attachments. The first thing you want to do is get in a cross-legged position. Cross-legged position, just sitting at the end of the bed or sitting at the end of a chair. Cross your legs with the affected foot over the knee of the other foot. So this is my affected foot here, and I'm just going to hold it with the hand closest to my heel. Now I'm going to bring my other hand and grab the toes. I'm going to grasp the toes and the forefoot, and I'm going to gently bring the whole ankle and forefoot up. So I'm bending my ankle up, I'm bending my toes up, and I'm holding that for 10 seconds. And it's really important not to hold it longer than 10 seconds. If you hold it longer than 10 seconds, you're really not doing any good. And so what I'm feeling when I do this is primarily I'm feeling a stretch right through here in the plantar fascia. And so when we bend the toes up like this, we're stretching out that plantar fascia. And when we bend the ankle up, we're stretching the Achilles tendon. And these things are both related. They're both connected. We need to really address both when we stretch. So to kind of review with you, you grab the heel like this, grab the toe, and you pull back and push back so that the ankle is dorsiflexed or extended backwards, and then the toes are extended upwards, and you're going to feel a stretch through here. You're going to hold this stretch for 10 seconds. You're going to relax for 10 seconds, and then you're going to repeat. 10 seconds of hold, back, 10 seconds of relax, and you're going to do that 10 times. Like I mentioned previously, you can either do this just before bed or first thing in the morning before you get out of bed. The nice thing about this stretch is that there's no special equipment that's needed for this. You don't need a belt or a towel. You just need your hands. And of course, we always have our hands available, so it's pretty easy to perform. Don't have to find anything. The second thing that you do once you've done the 10 repetitions is you want to do the cross-friction massage. The cross-friction massage, then, you grasp the forefoot like this, you bring it back, and what that does is that puts a stretch on the plantar fascia right in this area. Take your thumb, generally lubricate this area with some kind of skin lubricant so that your thumb glides over the area. And you want to then push down here, right behind the ball of the foot, and then glide your thumb along the course of the plantar fascia back to the heel, okay? And now we've done one stroke. This is the medial band of the plantar fascia, we call it. So you're pressing down firmly as you can stand it, and you're going down the medial plantar fascial band like this. Second, you come up again. Now we're going to do what's called the central plantar fascial band. You press down firmly. You can see the blanching of my finger there. I'm pressing down firmly. And we stroke that back through the course of the plantar fascia down to the base of the heel. Then we repeat that to the lateral plantar fascial band. So stretching it back and down. And I'm pressing down very firmly when I do this. Now, the second step is to do a cross-friction massage. And the cross-friction massage, we're going to start from the inside of the heel, again, using the thumb. Make sure this area is well lubricated. And you're going to press down firmly, and you're going to move across those fibers of the intrinsic muscles and the plantar fascia, and you're going to slowly move towards the toes. So you're kind of covering the whole area. And we're sweeping from medial, central to lateral of the plantar fascial band. And we do that and we move distally or towards the toes, right up through here. And then we repeat. We go medial, central, lateral, and then we do the cross-friction massage, pressing very firmly. Obviously, you want to do it a little slower. This is just for demonstration. Do that for about 5 minutes. So again, to review, it's first, we're going to do the stretching of the plantar fascia, which is grasping, pulling back, pushing back on the ankle, hold for 10, relax for 10 repetitions. Then we're going to do the cross-friction massage. First, we start with the orientations of the fibers, then we go across, and you do that for about 3 or 4 repetitions, 5 minutes. It kind of depends really on your symptoms. If you have a very painful plantar fascia, you're not going to want to do that too much initially because it's really going to make you sore, like I've mentioned previously.